Hello, and welcome. Today we're delving into a specific and often overlooked complication of diabetes, diabetic cardiomyopathy. This is a heart condition that develops as a direct result of the metabolic abnormalities caused by diabetes, independent of other common cardiac issues like coronary artery disease or hypertension. So, what exactly causes diabetic cardiomyopathy? The primary culprit is prolonged exposure to high blood sugar levels, or hyperglycemia. This leads to a cascade of detrimental effects on the heart muscle. Insulin resistance, common in type 2 diabetes, also plays a significant role. This resistance forces the body to produce more insulin, further impacting cellular function. Other contributing factors include increased levels of free fatty acids, oxidative stress, and chronic inflammation, all frequently seen in individuals with diabetes. Now, let's break down the pathophysiology, or how this disease develops at a cellular level. Diabetic cardiomyopathy essentially weakens the heart muscle in several ways. Firstly, hyperglycemia leads to the accumulation of advanced glycation end products, or AGs, which stiffen the heart muscle. Secondly, abnormal calcium handling within heart muscle cells disrupts their ability to contract and relax properly. Thirdly, mitochondrial dysfunction impairs energy production within the heart cells, leaving them weakened. Finally, fibrosis, or the thickening and scarring of heart tissue, further impairs the heart's ability to function effectively. All of these changes ultimately lead to heart failure. Epidemiologically, diabetic cardiomyopathy is a significant concern. It affects a substantial portion of individuals with diabetes, often remaining undiagnosed until more advanced stages. Studies suggest that diabetes significantly increases the risk of heart failure, and diabetic cardiomyopathy is believed to be a major contributor to this increased risk. The prevalence of the condition rises with the duration of diabetes and the degree of glycemic control. What are the signs and symptoms to watch out for? In the early stages, diabetic cardiomyopathy may be asymptomatic, meaning there are no noticeable symptoms. As the condition progresses, individuals may experience shortness of breath, especially with exertion or when lying down. Swelling in the legs and ankles, fatigue, and irregular heartbeats are also common symptoms. It's important to note that these symptoms can overlap with those of other heart conditions, making diagnosis challenging. Diagnosing diabetic cardiomyopathy involves a combination of clinical evaluation and diagnostic testing. A thorough medical history, including diabetes duration and control, is essential. An electrocardiogram, or ECG, can help detect any abnormal heart rhythms. An echocardiogram, which uses sound waves to create an image of the heart, can assess the heart's structure and function. Cardiac MRI can provide more detailed imaging of the heart muscle. Blood tests to assess blood sugar levels, kidney function, and markers of heart damage are also crucial. While diabetic cardiomyopathy isn't typically categorized into distinct types, in the same way as other cardiomyopathies, it's important to recognize that the severity can vary significantly from patient to patient. Some individuals may experience predominantly diastolic dysfunction, where the heart struggles to relax and fill with blood, while others may have systolic dysfunction, where the heart struggles to pump blood effectively. Some may even have a combination of both. The treatment and management of diabetic cardiomyopathy focus on controlling blood sugar levels, managing symptoms, and preventing further damage to the heart. Tight glycemic control through diet, exercise, and medications is paramount. Medications commonly used include ACE inhibitors or ARBs to lower blood pressure and protect the kidneys, beta blockers to slow the heart rate and reduce stress on the heart, diuretics to reduce fluid buildup, and SGLT2 inhibitors, which have shown promise in improving heart outcomes in people with diabetes. Lifestyle modifications such as a heart-healthy diet, regular exercise, and smoking cessation are also crucial. Prevention is key when it comes to diabetic cardiomyopathy. Maintaining optimal blood sugar control through diet, exercise, and medication is the most important preventative measure. Regular monitoring of blood pressure and cholesterol levels, along with prompt treatment of any abnormalities, is also essential. Adopting a healthy lifestyle, including a balanced diet, regular physical activity, and avoiding smoking, can significantly reduce the risk of developing this condition. The prognosis for individuals with diabetic cardiomyopathy can vary depending on the severity of the condition and the effectiveness of treatment. Early diagnosis and aggressive management can help slow the progression of the disease and improve quality of life. Recent research has focused on identifying novel biomarkers to detect early-stage diabetic cardiomyopathy and developing targeted therapies to address specific pathways involved in its development. For example, some studies are exploring the potential of therapies that target inflammation and fibrosis in the heart. While there is still much to learn, ongoing research offers hope for improved outcomes for individuals living with diabetic cardiomyopathy.